whether they have chronic kidney disease or transplant, both are more likely to have complications during pregnancy. One thing is that the fertility decreases significantly on dialysis. It improves after transplantation, but on dialysis, the fertility levels are definitely low. And even when they have chronic kidney disease, per se, even when they are not on dialysis, pre-dialysis stage also, the fertility levels are much lower than a normal female who does not have chronic kidney disease. Most of the females who have chronic kidney disease will have associated comorbidities in the form of diabetes, blood pressure, anemia. So all this also adds to low fertility rates. And if they become pregnant by chance, then of course it adds to the higher morbidity levels. So
Right.
definitely patients on chronic kidney disease who are planning to become pregnant, it should be a planned pregnancy in consultation with your nephrologist so that she is at an optimal health as possible when she becomes pregnant.
Hmm.
And secondly, there are certain medications which probably will have to be stopped 6 weeks to 2 months before she becomes pregnant. So it should
Right.
ideally be a planned pregnancy. So primarily the discussion should be with the nephrologist. And there are certain set criteria, things like I'll mention two, three of them, that the duration from transplant should be at least 2 years. The renal function should be absolutely stable, blood pressure should be stable, there should not be any proteinuria, and a couple of other preconditions before a female becomes pregnant. So these three, four definitely should be met, not 2 years before successful transplant, with a good renal function, no blood pressure, controlled blood pressure on one or two drugs, and no proteinuria. And when a female plans to start her family, she should go to a nephrologist, tell her that that is how she wants it to be. So the nephrologist can see that she fits into all these parameters. And of course, like I said, certain drugs would have to be stopped, say 6 weeks to 8 weeks before she plans to become pregnant.